Hey guys, welcome back to my channel Dr. Inspires. For those who don't know me, I'm Mahesha. I'm an international medical graduate currently working in Australia. And if you are new to my channel, like and subscribe and share among your friends because I share tips and insights for the international medical graduates looking for their first job here in Australia. So today I thought to cover an important topic. Now that most of the campaigns are closed, this is the time that you would get called for an interview if your application had been successful. So I thought to do a series of videos to help you step by step, giving some guidance on how to face an interview, what kinds of questions would they ask in an interview, and how to crack these questions to land your first job here in Australia. So, as the first part in the video series, I thought to discuss about understanding the interview process. And why I thought to start off with this is because when I got called for my first interview, I didn't know what to expect. I didn't know what kind of questions they would ask. I didn't have straightforward material to go through to prepare for the interview. I just searched on random Facebook groups. What kind of questions can you expect as a junior doctor who is going to start the first job in Australia? I searched on YouTube how to answer the clinical questions. So this was not straightforward. So I thought this would help whoever is sit for their first interview to give some light, to give some guidance on what to expect in an interview when you get called for one. Okay, firstly, let's talk about how interviews are conducted. I know this might sound like a very stupid question, or you would say, oh, that's a very common sense question. But the time that I put in the applications, I actually thought to myself, like, if I get called for an interview, do I have to go to Australia physical to face the interview? Right. So, um, obviously, now that most of you are aware how the interviews have been conducted, or your friends have gone through the same process, you obviously know these are virtual interviews. So, but I still do get these question asked like, Doctor, do we have to actually go to Australia for the interview? Okay, so all these interviews are virtual interviews. They get conducted either through Zoom or through Microsoft Teams. So if you are successful with your application, you would get an email saying your application had been successful and we would like to schedule an interview with you. So when you say yes, I'm happy to go ahead with the interview, so they will send you a link, a Zoom meeting or a Microsoft Teams link for you to join for the interview with the date and the time. So what's important to remember here is all the time that they mention that is in the Australian time zone. So if you are obviously in a country where you are 4.5, 5 hours behind the Australian time zone, please be mindful that you have to log in at the correct time so that you won't miss the golden opportunity that you get to interview to start off your first job here in Australia. Okay, so next we're going to talk about who will you see in front of you when the meeting starts. So let's talk about the panel. So the panel actually depends on the availability of each hospital. So the panel can vary from one person to either 4 or 5. But I would say it's very unlikely you will have 5 people in one panel because I don't think they can get 5 people for one interview because interviews are conducted in different sessions on each day. So they would definitely not have 5 people in one panel. So I would say 4, basically. So um, I remember for my first interview, it was just one person. And then the second interview that I went through, it was, I guess, 3. So it always depends. So let's talk about who are the people usually present in a panel in an interview conducted by a hospital. So, number one, you would get either the medical director or the director or deputy director of medical services. So, usually, this person would be the most senior person in the panel. And then, secondly, sometimes that can be a consultant or a registrar relevant to the department that you applied for. But sometimes, if the director of the medical services is able to ask the clinical questions, you might not have a consultant or a registrar in the panel. And then you would have either a nursing officer or a member of an allied health team as part of the panel as well. And then the fourth person would be a medical workforce officer, where you call the human resources in your country. In my country, we call it human resources, but commonly here they call it the medical workforce. So you would have an officer from the medical workforce as well. So I remember for my first interview where I said it was just one person, it was the director of medical services, and basically he asked all the questions. And then the second interview that I went through, there were three people. There was one consultant, and then there was an allied health professional, and the third one was a member from the medical workforce. So the panel always depend on the availability of each hospital, but usually this would be the composition of the interview panel. So, what is important in knowing the panel, or what is the importance in understanding the composition of the panel? So, the importance is that each person in the panel has different expectations because there will be different questions asked by each member of the panel. So, they are going to assess you in, I would say, in different views. Okay, so one person would assess your clinical competence, and the other person would assess your compliance or how you manage, how you maintain your professionalism. So the composition. So the importance of understanding the composition is to know that they have different expectations. So let's go through it one by one. So if you have the director or deputy director of medical services in your panel, what would they expect? So this person, as I said, is the most senior person in the panel, and what do they expect from you? So basically, what they want to know is, are you a doctor who is able to practice safe medicine? As a junior doctor, do you know your limitations? As in, when do you have to escalate? If you are a resident, do you know when you have to escalate to your registrar? If you are a registrar, do you know when you have to escalate to your boss? So they will assess your understanding about your limitations. And then they will also assess how you can contribute to the healthcare system. So, in general, these are what the deputy director or the director of the services would expect from you. And then, if you have a consultant or a registrar in your panel, what would they assess? So, basically, they would assess your clinical competence. So, this is the person who would ask the clinical questions from you. So, they will assess your clinical competence, and they will assess if you are able to manage common ward situations or common ED presentations. And also at the same time, they're going to see if they will be comfortable working with you. So the clinical scenarios are mostly asked by this person. And if you don't have two persons, so the director of the medical services would probably ask the clinical questions as well and assess what I mentioned just now. The third person, a nursing officer or an allied health professional in the panel, what would this person expect from you? So basically, it's important to understand. This was actually new to me as well. What's important in the Australian healthcare system is that the nurses and the allied health professionals are they play a very important role when it comes to manage patients. So when I say allied health professionals, um, physiotherapists, occupational therapists, a social worker, a chip nurse, we call a chip nurse is a person who would help, who would work together with a social worker, and then you would have like diabetes educators. So allied health professionals are a big team. It's a big team. So it always who is involved is all it always depends on which kind of patient you're managing. So basically what they would expect from you in an interview is that are you a teamwork, like are you a person who's able to work in a team, and how is your understanding about working in a multidisciplinary team, and how do you respect uh, a view or an opinion of another team member? What is your understanding about collaborative approach? So these are the kind of expectations of a member in the panel who is either a nursing officer or an allied health professional. So this is actually, I would say honestly, it was new to me because where I come from, we obviously do have allied health professionals, but then um, they're not like very hands on or very actively involved with the doctors when it comes to managing patients. So that's why understanding about teamwork and especially understanding about working in a multidisciplinary team is important. And that's what this person would assess in you in an interview. And then member number four would be a member of the medical workforce. Okay, so basically, this person would most likely assess your compliance and also what is your understanding about the policies in the hospital, and also how would you fit to the hospital values. Okay, so I mean honestly, like when I say like this, it might be difficult to understand, but as I said before, I will break down in my series of videos on how to meet the expectations. Okay, um, so these are the expectations of the deputy director or the director of medical services, then a consultant or a registrar in the panel, then a nursing or an allied health professional in the panel, and then a medical workforce officer in the panel. So what you need to do is um, talk what they want to hear. Okay, so now you have an understanding about the composition of the panel and what the expectations are. Let's talk about the style of questions that you can expect in an interview. So, question number one would usually be a personality based question. So, what do you mean by this? So, the important thing is this question can be asked in different ways. So, you need to know uh, how to crack them if they ask in the different ways. So, they can ask like, talk us through your CV and what is your experience and why do you think you're the best candidate for this role? Okay, and what is your biggest strength? What is your biggest weakness? So the personality questions can be asked in different ways. So you need to know what to say when they ask you these questions. And also, as I said in my next videos, expect me to elaborate them more, and so that you will be able to understand how to structure yourself when they ask you these kind of personality questions. Okay, and then the next questions would be clinical questions. So usually you would most likely would get two clinical questions. Sometimes it could be just one even. So what you need to understand is that from these clinical questions, what they ask is not for you to basically manage the patient, but what they really want to assess here is how would you approach to manage the patient? Okay, for an example, the clinical question would be a 34-year-old gentleman coming with a 10 out of 10 chest pain. So you're the only doctor in the ED, and let's say this is happening in the night, and you're the doctor on call. What are you going to do? So they want to know. They don't want to know how you're managing, like how you're treating the chest pain, but basically they want to know how you're going to approach to manage this patient with the chest pain. Okay, so in the clinical questions, basically that's what they want to know. So are you a doctor who would call your boss or your registrar and say, I have a patient with 10 out of 10 chest pain, what should I? Or are you a doctor who would attend to the patient first and make sure the vitals are stable? Okay, so basically in the clinical questions, what they expect is how you're going to approach the patient. So here they're not going to expect, for an example, if it's like a MI patient, they're not going to expect you to know the guidelines of managing the MI patient. So you would definitely should have a little knowledge, like common sense knowledge about what you would do in when managing these patients, but they don't want on the dot treatment. They don't want you to know on the dot treatment protocols when you get these kind of patients. Okay, so let's talk more in my videos about this. Then the third type of question that you would get asked is usually an ethical or a professional question. This was really new to me. Okay, so here what they would ask us, like few examples of questions they would ask. Your colleague attend drunk to work. How are you going to manage this situation? Of you would get questions asked like a nurse had administered the wrong dose of medication. How are you going to manage this situation? And you have a conflict with your consultant. How are you going to approach to handle this situation? So usually these ethical and professional questions are work based, like conflict situations. As a junior doctor, they want to know how you're going to manage or handle these kind of situations, and do you know do you know when to escalate, or do you know whom to escalate these kind of situations? So these ethical and professional questions are usually asked for you to assess, basically for you to assess if you have an idea on how to handle these conflict situations, um, without causing a lot of problem to yourself. So another type of question that you can get asked is the communication questions, a question that would assess how you communicate either with patient or a patient's family. For an example, I would say, so you have a patient with metastatic prostate cancer, and the family is coming to you asking what's happening with the treatment and what they have to expect and what is the prognosis. So, in these kind of situations, do you know how to communicate with the patient and the family? Do you know how to communicate with them in lay terms and not using medical jargon? So, sometimes you can get asked these kind of communication questions. And do you know how to handle when the questions have been asked by the family? Do you know how to handle them? So, these kind of questions sometimes can get asked if you're, I would say, if you're applying for registrar positions, these kind of questions can be asked as well. So, a few additional tips to keep in mind when preparing yourself for an interview. So, usually the duration of an interview would be 20 to 30 minutes. So, it always depends on the number of questions that you get asked. And please make sure you have good internet connection and good lighting. Okay, and it's always preferable for you to have headphones so that you can clearly hear the questions they ask. And please dress formal. It's actually like you're going for a face to face interview. So they are seeing you through a camera, but you have to make sure you're dressing in a formal manner because that is the first impression. So please make sure you're well groomed on the day of the interview and you're wearing something formal for this interview. And also, an additional tip is that whichever hospital that you get called for an interview, make sure you do a little research. Just Google like the values or mission of that hospital so that you have an understanding and that shows that you have done some research and that you have done homework before you come to the interview. So do a little research as well. And the next thing is sometimes they can it would be different. Sometimes they can ask you the question and expect you to answer then and there, and sometimes they might give you like 1 or 2 minutes to write down a few points or prepare yourself and to answer. So it depends. So it depends from hospital to hospital on what way they conduct the interviews. Yeah, so this is in general how interviews are usually conducted and the composition of the panels and what kinds of questions that you can get asked in. Um, okay, guys, so this is the first video in the series. So in the next video, I am planning to talk to you about how to structure your answer when they ask you the personality questions. Okay, so step by step, let's go through each point, how to present yourself, where to start, where to finish, and how to time and practice these answers. So I hope this was helpful. So I wanted to start with this so that you have an idea, how the interviews are conducted, just to give a brief introduction about how interviews are conducted. Because where I come from, I've never done with a hospital. Okay, so the government says, go to this hospital, I go there and work. So this was all new. And I would say for most of you, this would be new as well. So I'm doing this series to guide you step by step. So next video, let's prepare ourselves to answer the personality questions. So until I see you guys in my next video, take care and see you all.